the use of ACTH certainly is reserved by its FDA-approved indication. It is approved for MS relapses. So therefore, we use it in a setting of any relapsing form of MS, including relapsing remitting MS, for the acute treatment of MS exacerbation. That is the approved indication, and this is where we use it. Again, we use it rarely, if ever, as a first line. This is due to the financial differences in between the coverage of systemic steroids with ACTH, which ACTH currently is much more expensive option. So therefore, the first line of therapy remains systemic steroids, and also it's supported with excellent experience and very robust response to it. ACTH is reserved for those options or situations when systemic steroid is not feasible, contraindicated, or failed previously, or more frequently patients had intolerable, life-threatening side effects, such as, for example, acute psychosis, steroid-induced acute psychosis. That would be the most vivid presentation of preference of using the ACTH. I would like to point out that sometimes it's being noticed that the list of potential side effects of ACTH is very much resembling the list of potential side effects of the systemic steroids. Again, the information comes from 1970s of time of approval, when the concept and understanding of ACTH mechanism and clinical efficacy was coming entirely from the steroidogenic effects. And steroids, like production of the cortisol, is only minor part of how ACTH really works. In order to support this, I would like to point out there was a very important study done back in 1990s when anti-inflammatory effects of ACTH were evaluated on adrenoectomized animals. Animals without adrenal glands were enabled to produce cortisol, obviously, but still were able to show strong anti-inflammatory effects of ACTH in the absence of steroid-producing adrenal glands. It's very, very interesting and important to remember. ACTH has its own direct anti-inflammatory effects. However, when you look at the list of the side effects, you may get an impression that they are absolutely equal. Methylprednisolone and ACTH has the same list of psychiatric side effects listed with the steroids, and they may be listed with the ACTH. However, when it comes to the equivalent production of cortisol as a result of the stimulation of ACTH, that production is less than 3% as compared to the 1 gram salumedrol. So you may expect the potential steroidogenic side effects to be just a fracture of what has been experienced in the setting of the systemic steroids use. And that has been supported by my clinical experience. So those patients who, for example, had acute psychosis as a side effect of the systemic steroids did not have similar reaction in my practice when ACTH was used.